Hey guys, Dr. Paul here. Now, impressions are something that we do almost every day in dentistry. Now, we take an impression or a mold of these teeth to turn into a model. Now, these models, we use them to make things like dentures or mouth guards. Basically, a lot of things are made from these models. Now, the more accurate that model is, the better fitting everything that we do is. The less adjustments, the more comfortable it's going to be. A lot of things come from that model, but that model comes from the first impression. So getting that impression accurate and perfect is really, really important. Now, it's not something that's actually difficult, but it's also not very simple to get it to be perfect. Now, in this video, I'm going to show you some steps to actually get it as close to perfect as possible. Things like how to reduce air bubbles, how to capture some difficult areas, how to make sure that your alginate stays inside the tray really, really nicely, how to mix alginate, how to pour up models, how to get accurate models. There's a whole lot that you're gonna see in this video. I hope that you enjoyed it. It's not gonna be a short video, but for a dental student or a dentist that wants to up their game, or if you wanna train some of your assistants on how to take impressions, this is gonna be the perfect video. Enjoy. So for the purpose of this video, I'm going to be the patient. Now, the first thing you want to do is make sure that your trays fit really well. So before you do anything else, make sure that the tray fits. Now, what you want to do is you want to put, my hands are sanitized, don't worry, put them in, and then make sure that it covers all of the teeth that you're actually trying to capture. And as well, you're not hitting on the teeth as you go in. So what you want to do is pull across with your finger or with a mirror and slide this in at 90 degrees like this, and then feel with your finger to make sure that all of the teeth are covered. You might want to also practice that a few times to get the muscle memory. With the top one, I also try to make sure that I seat it at the back first and then to the front to make sure that you don't get excess material down the patient's throat. Now the same with the bottom. Perfect. So if that tray doesn't fit, try another one. If you can't get one fitting, you might want to heat it up with a Bunsen burner to actually melt and move the plastic so you can get it fitting custom for your patient. Now, when you take the impression, it's really important that obviously the impression material stays inside the tray. These little holes in the tray are to allow the material to go out and get locked in place. However, you will know that if you've done this before, is that there's still a little bit of distortion when you pull it out. It doesn't perfectly stay in. So what I use is this guy here. This is a Fix Adhesive, which actually fixes the alginate onto the tray. You can also use this for PVS as well. There is a PVS adhesive that helps a lot for those impressions too. When the alginate sticks to the tray, it means that the alginate's much, much more accurate. So I'm gonna put it on one and I won't put it on the other so you can see the difference. So you're gonna spray this. You don't need very much of it. A little around the outside, a bit here. And then wait for it to dry a little bit. You can wave it back and forth or just give it some time. Now, it doesn't have to be perfectly dry, but after about 30 seconds or so, this will be perfect. I'm not gonna do it to the other one so you can see. Now, this adhesive that we use, you'll notice that there's a lot of pink that gets stuck here. Because this is so sticky, it'll clog this and it's gonna start going everywhere like it does with this. So, as soon as you're finished with it, use some eucalyptus oil to clean this to make sure that it still comes out easily the next time. For your primary impression, you're most likely going to be using a stock tray. The problem with stock trays is that areas like this, they're one size fits all. So if someone has teeth that are all the way back here, you might not capture them properly with this stock tray. Same with the frenum just here. What I use is periphery wax. Periphery wax, it's this very soft wax that you can mold into place. That area is going to be captured really well in your impression. Now, it's soft enough that when you put it in, the gum and the cheeks and everything will push it out of the way, so it's going to mold to it really well. So you can put it here at the back. Now for the upper one, you can also put some all the way back here if you're worried about this going down the back of the patient's throat, but most of the time you don't need it. So now we're up to the point where we're going to mix the alginate and take the impression. Now, this can be a procedure that can make some patients gag. So there's a few things that I do to try and help reduce that. First is I have them sitting up in the chair. If they're sitting back, that material can go to the back of their throat, make them feel like they can't breathe properly, and that's when they start gagging. It's the gag reflex. It's them thinking that they can't breathe properly. The other thing that I'll do is I'll do the lower impression first. If you do the top one first, it's more of a mouthful. The material can go down the back of their throat, can start to make them gag. If you do that impression, then come to do the lower one, they're already in this heightened state that the lower one shouldn't make them gag, but it is more likely to. What I do instead is I'll do the lower one first. It almost gives them confidence that they're okay to do it, then we'll do the top one. The other thing I'll make sure before we start, I'll tell them, this is gonna be a bit of a mouthful. What I'd like you to do is sit forward a little bit, breathe through your nose. Nice deep breaths. If they're breathing through their nose and concentrating on that, their mind doesn't really let them think about how the fact their mouth is so full, because their airway is nice and open. The other thing, you can get them to wiggle their toes or lift their feet. One final tip is if you know that your patient's a really bad gagger and you're taking an upper impression, maybe don't use an upper tray. You can also take upper impressions with lower trays. There's less material, less chance of gagging. I find that works really well. Now the last one to mention is putting salt on the patient's tongue. I don't 100% know the theory behind this, but we always keep a jar of salt in our room, and you get a cotton roll, you wet the end of the cotton roll, dip it into the salt and then onto the patient's tongue. And then while they have that salty taste in their mouth, that's when you take the impression, and that works quite well. Before we take the impression, the last thing I wanted to talk about was air bubbles in your impression. Air bubbles in the impression are a big problem because they'll lead to inaccuracies in your final model. They happen because of two ways. One is because of how you've mixed your alginate, which you'll see how to mix it in this next little bit of the video. The other way is in the impression technique. Now, when you come to actually seat the tray that's full of alginate over the patient's teeth, air gets trapped on the biting surfaces of the teeth and in between the teeth. That air has nowhere to escape. So as you seat it further down, the air ends up getting trapped in the material, and then it actually forms an air bubble in the material, and that's how you get an air bubble. So what I'm going to show you is a really easy, quick technique to do right before you take the impression to eradicate the chance of air bubbles. I'll do one with and one without so I can show you the comparison. So now we're going to mix our alginate. Now this one, I got lines for it to measure. If you're brand new, you might want to make this mix a little bit more runny. If you make it more runny, you've got a bit more time. The less water that there is, the faster it's going to set, and if you're new and you take a bit of time, you don't want to be too rushed. Now, when you're mixing it, basically you want to do small movements until it's all together like this, and then you can start being a bit more aggressive. And you want to basically do what we call kneading it. So you want to just push it down and squash it together to get rid of the air bubbles, like this. Now, that looks pretty good. So then what I'll do is I'll get a large amount on my spatula, so like this, and I'll do half for here, then I'll do half for here, and pulling or pushing downwards to make sure that there's no air bubbles in underneath here, and then it's about making some finer adjustments to fill in those spots. When you're first learning this bit's kind of difficult, but eventually you'll get really good. Now this is perfect, this is ready to go. One thing that you can do with this is you can wet your finger and go like this to smooth it, to help try and reduce air bubbles. I don't do it very often, but you can. I'll show you how to do the impression first on myself, then I'll show you on a real life patient, and I'll also do some commentary over the top of the video so I can explain what I'm doing. So you'll take some of the mixed alginate and you'll put it on one of your fingers, and then you're going to rub and agitate it and push it down into the teeth. That way you're forcing the air bubbles out. Then after you've done that, you'll take your alginate filled tray and you'll load it into the mouth. So you'll turn it on 90 degrees, pull with a finger or with your mirror, and then seat down into place. You'll then get the patient to poke their tongue out. That's actually so you can capture the area of the tongue, and then to capture the cheek and all of the shapes that you've got of your lips, you'll then move the lips and cheeks and push them apart. Then you'll take it out and it goes to the sink. All right, so then when we put this in, finger on this side, turn it on the side, go across, seat it more at the back first, and then fingers to go down. Then you'll want to pull the lip away to get rid of air bubbles for the final bit of seating. Down like this, pulling the lip up, and then pop your tongue out for me. Yep, and then relax your tongue. And then we're just going to hold that into position. You can as well do this to border mold the edges, but now it looks like it should be pretty good. Then we're just going to hold that till it sets. Now we'll mix the top one. For the bottom one, I often use 2 scoops. The top one, I use 3 just to make sure that there is enough. I don't always use the full amount, but it's better to have too much than find that you don't have enough and you need to retake it. You might also hear some people say that you have to put the water in first and then the powder. I don't think it makes a big enough difference. So mix, 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 very small till it gets to this point, and then you can be more aggressive. And again, I'll get a large scoop on here, and then I can do this one basically in one motion, pulling down, and then across, and then at the back, making sure it's level and there's not too much. That looks good. So you'll pull across with your finger or your mirror, and you'll seat it at the back first, and then you'll seat it over the front teeth, and then as you seat it on the front teeth, you'll want to pull the lip up to stop air bubbles and stop it getting trapped, and then pull the lips and cheeks across so you can do what we call border molding, which you're basically molding the cheeks to the shape of the alginate so it can capture their shapes really, really well. Then once it's done, you hold it in place. If you find that it's stuck and it's hard to get out, get the patient to put their lips together and puff their cheeks up to get air underneath it. Then use one of your fingers up under the corner to help pull it down and wiggle back and forth. You're going to come from behind, one finger, or you can use your mirror on the side to pull the cheek across. Come in at about 90 degrees. So just staying open, James. And then you go in. So we're going to seat at the back first. Pull the lip up to stop air bubbles. And then seat forward. Then switch hands. Pull the lip across to get rid of those air bubbles. Check from underneath that you've got the back there. That looks good. Manipulate the lip. And then wait for it to set. Now I probably got some blue stuff on my mouth, but I'm in the zone. So now it's all well and good to take an impression, but you have to make sure it's a good quality impression. So before you're finished with these and they go off to the lab, you need to assess them for quality. So I'll show you what to look for. So the main two things are air bubbles and also that you've captured the teeth properly. If we first look for air bubbles, basically what you're looking for are spots like this. There's an air bubble here, small air bubble here, a little bit of an air bubble here. Everywhere else looks pretty good, but you'll see that those air bubbles, they're about 6 or 7 millimeters beyond the margin of where the teeth are. That's not something that's going to concern me, and it's not going to impact the future model. Just a quick note on this. When you're assessing this, it's very important to know what you're taking the impression for. If you're taking these for some dentures and you need the extensions really far into the sulcus and it's important to capture that area, you don't want air bubbles there. If you're making some whitening trays, for example, it doesn't really matter if there's an air bubble right in the depth of the sulcus because that's not important for when you're actually making the tray. The other thing is making sure that the teeth are all well captured. When I go around and have a look, all perfect, really good. Now look at the top one. We've captured the frenum area really, really well. Slight air bubble along here, but again, if we look at how far away that air bubble is from the teeth, no drama. When we look at the teeth, they all look really good as well. Now, the difference between using the adhesive or not. This alginate is basically stuck onto the tray here. There's no moving it. On a tooth without the adhesive, you can see that it pulls away. If that pulls away, that's going to distort the shape here and your model is not going to be as accurate. So I always use adhesive to get the best accuracy. Now with these, after you've taken the impression, you've assessed them, you're going to rinse them under water to get any blood and saliva off. You normally have gloved hands, but I'll sanitize all of this when I'm finished. Then you're going to spray it with some disinfectant. Now the accuracy of alginate is only good for about half an hour or so. Then it actually starts to shrink and change shape and it loses its accuracy. These need to get poured up in the lab pretty much straight away. To help with their accuracy, they have to stay moist. So after you disinfect, you're going to wrap with paper towel. Now it's ready to go to the lab. So your impressions have just moved from the operatory now into the laboratory where we're going to turn them into really good quality models, and I'll show you some tips to help do that. So this is our setup. I've got a tile with some paper towel here. We've got a vibrator that I put a piece of paper towel on so it doesn't go all dirty like what it has in the past. And then we have our stone, then obviously our impressions. Hey, super quick, if you're getting something out of the video, please like, share or subscribe. It really helps me out a lot. All right, back to the video. Now the first thing is mixing stone. Now you can measure it out and do say 1 part water with 3 parts stone, for example, but I don't do that anymore. Basically, I know that a cup will get me enough stone for 2. So I will pour almost all of it in. I'll leave a little bit, which we're going to use later. And then how much water I need, I do it by consistency, just letting the tap drip. Now don't have the tap on too hard, otherwise you'll get too much in there. So there's probably better. And then you mix. And then as you see that, okay, that's really, really firm, need to add more water. Keep mixing, and then stop, and then mix again. Starting to look better, but still quite clumpy. Mix more water. At this point, you don't need very much. A little goes a long way. A little bit more. Oh, and I think we might be there. The consistency that you want is if you lift it, it comes off of your spatula quite quickly. And it has this kind of glossy appearance, which that actually looks perfect. If you find that you accidentally put too much water in, you can tip it up till some of it drains out, and then you can mix, and then if you need to, you can add more powder. Now you're going to bring it to the vibrator and turn it on to get rid of the air bubbles. So you vibrate, you push, move it around, agitate it with your spatula, all to get rid of these air bubbles. And I think that's looking pretty good. So now we're going to put the stone onto the teeth. You want to start with a little bit on one of the sides and just do it very slowly. Watching it as it goes around from tooth to tooth. Adding bit by bit. This bit here is the most important and it's the bit that you want to be the most accurate, so don't rush this bit. That looks good. Now this is where I normally leave it, but I've been shown before by a lab technician that he used to then flip it upside down and then back again to really make sure that there's no air bubbles, but I find that I don't need to. Once you've filled up the occlusal surface, so the main bit where the teeth are, you can then start adding it a little bit faster. Once you've finished with this whole top section, move to the other one. Now, for these little bits, I don't need to use the vibrator, so I'll just basically finish them off with the stone like that, filling up to that point. Now the eventual model is going to look like this, and basically everything up into this section here is what we call the base. So the base is like a chunk that this is going to be built up on. It's like the foundation. Now for the base, we can wait till that stone that we've got set, so we wait 5 minutes till it becomes a bit harder, then make the base and then put them together, or you can do what I do and speed that process up so there's no time that's wasted. Now unfortunately at this point my battery actually ran out, and because obviously the material was setting, I couldn't charge my camera and then come back to it. So I'm showing you a different video, but it's the exact same process. You'll notice that the voice actually sounds a little bit different. I wasn't using my proper microphone. But what I will say is that with the base of the model, you have to make sure that it's nice and thick. If it's not thick, when you come to break it off the actual tray from the model, it's possible that the actual model can break in half. So make sure your base is nice and thick, but you'll see that coming up. We've got this, and this is still too soft. If you tried using this as the base and flipped it over, it's just going to squish everywhere. So we still have some of this left. You're going to add some of that to this mix. Stir it up, and basically the point that you're going to get to is till it basically loses its glossiness that you could see before. You can see it looks a little bit drier there. It's still a little bit too runny, so we're going a tiny bit more. Ooh, it's hard when I'm filming to do this properly. I'm standing in a weird position. And the consistency for here is that it's just staying on. But if you shake it a little bit, it comes off. So this is ready. You can do this bit basically pretty quickly because you don't actually need this bit to be that accurate. It just needs to be bulky enough that it's going to hold up for you. It doesn't matter if there's air bubbles along here. So you go like that. Get it so it's a nice big thick base, and because we have thickened up this mixture it's nice and solid, and then flip it over till it's like that. Now you can as well, if you find that you've got material there, you can put some tissue here to stop having a lot of excess in that area. I don't really need to, so I don't use it. Now my old boss told me that when you flip it over you can lose accuracy, so what he used to do was he would build it up like this. Build it up like that, get this bit of paper towel, fold it over, and then you can actually wrap it around so you're not flipping it. I don't like this way as much. I don't think it's very easy to do, but you can do it that way. Now the other way that you can do it is actually building up a base first. So you're going to get the rest of your mixture like this, something like that, build it into a bit of a mound, and then get this mixture, put it over the top, and then squish it together. So you can either build it all onto the one piece, then flip it over like I did with this one, or you can put a little mound, flip it onto that. Now the next bit is removing the excess material that you don't need before it sets really hard. When you get good at this, there won't be very much excess for you to actually remove like you'll see in the video. But when you're first starting out, there's probably going to be a lot of material that you just don't need. So you want to remove the excess up to the point where the tray basically finishes. Anything more than that, you don't need it, and it's just going to make it harder and longer for you to actually remove it later on. So if you can do it now, you'll save time. In this next part, you'll see how to do that. Now we're going to remove excess, but because we have actually thickened it, you can start cutting away that excess now, like this. So you're going to go around and remove it, and you want to basically put this vertically against the side of the tray to remove that. It's going to make the next stage a lot easier for you. Don't take away too much, so just run it around the outside. Vertical, taking away any excess, which is going to make it easier for you later when you're trimming it. Same thing here, we've come all the way up to the tray. Now if you're in an area like this and you can see that there's an air bubble, and that's an important area, if it hasn't set yet, you can always get some material and pop it in there to fill that space in. Or if it's a really big air bubble, sometimes we get really big air bubbles up in here, and if this is an important area, you can always mix up some more plaster, pop it in here, and then just wait for it to set. Okay, so now we're going to remove the impression from the model. Basically you want to get an instrument that's kind of like this and wedge it in at the join between where the impression meets the model. So you want to go in here, twist slightly, not too far. If you twist too far, teeth will start breaking off. So you do a little bit one side, come around to here, go to the other side, wedge to the middle, do a little bit there. As it starts to come off, don't rush it, don't get impatient and rush it, that's when teeth break. A little bit more, a little bit more. Once you get to this point, boom, pull it off. It's okay when someone has all of their teeth, but if you've got someone who has, say, a single tooth here and a gap there, if you pull it off too hard, that tooth's going to break off. Let's do the top one. Now, because we have trimmed it back quite well and we don't have a lot of excess to deal with, this bit is really easy because it's right at the point that we need to be doing the wedging. If you've got too much excess there, it goes all the way around the corner. One tip that I will give you, if you do have a lot of excess, say there's a lot of excess here, you can basically hit it off and it will clear those spots for you. So if you've got a lot of excess around the outside, knock it till those pieces come away. And then, same thing, twist, twist. Now, see how this is the one that we didn't actually use the adhesive, so it didn't come off as one. Not a huge issue if this happens. Basically just peel it off. It's just another step that you have to take. Okay, so now we're actually going to trim our model, and I'll show you how to do that. Okay, so you want to be holding with two hands so it's nice and steady. I'm just going to do it one hand for this demonstration, but you want to go in till it's at about that point. That's about how much you want to remove. You're going to go around. Always have 2 points, because if you slip, you obviously don't want to hit your finger. So if you've got 2 points, you're more likely for it to stay stable. Now at this point I've removed the majority of the excess, but there's still a bit more that I want to do. If I try and remove it like this, I'm getting too close to the teeth. So what I do, now you need to be holding it very tight, because if you slip, you'll end up sliding forward and damaging the front surface of the teeth. Now you want to be asking your dentist what you're actually using this for. So for this case we're using it for some retainers. So if I take away too much here, it doesn't matter. But if you're making something like a denture, sometimes this area is very important. So don't trim away too much of that without asking the dentist. Let's go to the bottom, same story. Now because we had that area in here, we don't actually have a lot of excess, so this means that we don't have to trim it away. If you did, you might have to use a burr to actually remove some of the excess that you've got here. So now we're back to the impressions that we took today. Now I want to show you what an air bubble in alginate results in. So an air bubble will end up being a spot that fills in with material like this. So there's an air bubble there, this little spots here, they're air bubbles. On the back here, air bubble, air bubble, air bubble, air bubble, air bubble. All of these, they're all air bubbles. If we compare this to the one where we put the alginate on the teeth first, that's part of the tooth structure. I'm trying to find maybe a slight one just here. Tiny little ones in underneath here. It's looking really good, so you can see that there's a huge difference. Now what this will mean is that if you have air bubbles everywhere and you don't remove them off of the model, when the lab puts these teeth together, then they're going to get in the way and they're not going to be able to put them together properly. Or if you're making something like a whitening tray, it's just not going to fit properly. It's inaccurate. So what that means is you need to have them removed. So you've got to remove them yourself, like this, and it's a very slow process, or the lab has to remove them, which they don't want to do, or you're going to have inaccurate models. So it's really important that you capture it really well the first time, which is with that little trick that I showed you. So there you have it. I hope that you enjoyed the video. I hope that you can now take better, more accurate impressions, and I hope that you can turn them into more accurate, perfect models. Everyone's happy. Like I said, it means that there's less adjustments required, your patients are happier, your dentist's happier, less chair time. It just ticks a whole lot of boxes. If you got something out of it, please like, share, subscribe. Those things help me out a lot. If you have any questions, put them in the comments section. Have a great day and keep on smiling.